Hi, everybody. Today I'm really excited to talk about a concept that's been foundational in behavioral health, and that is evidence-based practice, or EBP. You might already know about EBP and how it is increasingly central to clinical work. It's considered crucial for delivering high quality and very effective mental health care, according to Bride and Norcross et al. I want to explore the advantages and the limitations of EBP during this presentation and try to understand why it's so appealing to the managed care systems, but it's also controversial in practice. Next, I'm going to get into understanding evidence-based practice, and I'm going to talk about what EBP really means. According to the American Psychological Association, EBP is integrating the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. So this basically means that EBP isn't blindly following research. We're combining high quality evidence with our professional knowledge and each client's unique needs, creating specific BIPs, behavior intervention plans, or different goals for our clients. One of EBP's biggest goals is to enhance the effectiveness of service and ultimately public health. As Norcross et al. Put it, mental health professionals are challenged to demonstrate the effectiveness of the care we provide actively, and this call for accountability isn't just a trend, it's here to stay. It pushes us to improve our practice continuously, and it's continuously expanding the ways in which we can practice and help individuals in need. So, some advantages for evidence-based practice. It is a very valuable tool, and I am going to explain some of the reasons why it's so valuable. It is backed by research, meaning that we know certain approaches can yield positive outcomes for specific issues. CBT therapies are among the most studied interventions among the EBP, and with solid evidence for treating a wide range of issues such as depression, anxiety, PTSD, and even substance abuse, according to Anthony 2019 and Holland and Beck 2013, the advantage here is that practitioners using CBT can have confidence that these interventions will likely benefit their clients. Since there's evidence-based research, or there's research that backs the evidence-based practices, we know that these interventions are going to help our clients more likely than harm them. EBP is not limited to cognitive behavioral approaches, however. Research has shown that humanistic therapies, which focus on more personal growth and self-fulfillment, are also effective for various problems, from depression to relationship issues. Angus et al. Points out that humanistic therapies are supported by substantial evidence, showing that clients can benefit from a broad range of therapeutic models. And our authors, Corey et al., also back this statement up. This diverse evidence base means that we're not restricted to a single approach, that there's a lot of flexibility in the EBP model, allowing us to select treatments that will better fit our clients' needs. And if something comes up, we'll be able to adapt and work with that client. So here are some of the limitations of evidence-based practice that I found in my research. Despite having all the benefits, it obviously is not without limitations. One challenge is that it can feel restrictive, especially with its focus on manualized treatments. So managed care systems, for example, prioritize interventions that are brief, efficient, and backed by evidence, according to Pope and Wedding 2014. That's why managed care trends to embrace empirically supported treatments, or ESTs, which are specific therapies validated through rigorous research. This issue is that treatments don't always address the full complexity of clients' experiences in real life. Clients don't always fit neatly into this diagnostic category they have for certain patients. A lot of patients have co-occurring and comorbid diagnoses and different experiences that they've had throughout life, making it a lot harder for them to just fit into one neat category. These treatments don't always address the full complexity of the client's experiences. So many come to therapy with existential concerns, questions about meaning, purpose, or self-discovery that don't align with symptom-based treatments. As Lazarus and Rigo suggest, these manualized treatments can become limiting when clients present with issues that don't have an established evidence-based treatment. Another limitation involves the therapeutic relationship, so the relationship between the client and the therapist. Some practitioners believe that relying too heavily on sanctioned, standardized treatments can make therapy feel like mechanic, kind of like you're reading from a script. It doesn't feel personalized to the client's needs. It feels more focused on techniques rather than building a genuine connection with your client. Lazarus and Rigo argue that client-therapist relationship is essential to therapy, and I honestly really agree with that. I think without rapport with a client, or vice versa, rapport with a therapist, it makes sessions a lot harder, and I think it creates a wall where you're not fully going to be able to open up. Even the best methods and manuals may fall short without a strong working alliance. And that it goes for in the everyday life, if you think about it, a strong workforce, a strong team at your job, you have a strong, solid family house and a strong family belief or morals, or with strong foundation, you can create growth. And I think it's really important to have a strong foundation with your therapist and your clients. Some ethical concerns that are associated with the EBP is moving into ethical considerations. It has sparked some debate among clinicians. Empirically validated methods can feel like an ethical choice. Business considerations often come into play. For example, if you think about it, insurance companies have the ability to pressure therapists to use the minimal treatment necessary, focusing on the shortest and most cost-effective interventions for them based on what the insurance is going to be paying the therapist. So they're trying to kind of work in and create unethical scenarios where they would say, oh, he's fine, just charge him for yada, 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 just diagnose him with yada, yada, yada. Lambert 2013 warns that relying on specific lists of empirically supported treatments could be problematic. Some ESTs show only minor differences in outcome effectiveness, and promoting these as superior might be premature, according to our authors. The focus on efficiency or individual client needs can sometimes feel at odds with the therapeutic goal of supporting a person's unique journey. According in ethical terms and considerations, balancing efficiency with respect for each of our clients' needs and cultural backgrounds is probably going to be one of the most important things we can do as therapists. It's especially relevant for marginalized groups who may not have been adequately represented in the studies forming the backbone of EBP. EBP appeals to managed care because it's all about accountability and measurable results. Insurers want to be able to prove that the therapists are doing the work that they're doing, and they want to fund therapies that are proven to work. As Pope and Wedding explain, ESTs are designed to meet the expectations of managed care providers who emphasize short, standardized interventions that allow for tracking progress. Managed care systems value this structure, as it aligns well with their goal of reducing costs while still supporting clients' needs. This focus on brief, effective treatment has also led to significantly public initiatives. Experts are now developing programs to train clinicians in empirically based practice, expanding access to those services across mental health care, according to Godley et al. And McCloskey and Vismara et al. I believe it's really important to find a balance between the care you provide your clients and the EBP. EBP has real advantages, but it's really important to remember that it's not the only correct approach towards therapy. Embracing EBP as an only approach actually could create more challenges. Our authors suggest that while relying on research-based treatment, we shouldn't overlook the importance and the need for a human-based approach, human-centered approach. In my view, striking a balance between the two is key, so we're able to really create an effective care plan for our clients that's tailored to their individual needs. And when they get flexible, we're able to be flexible with them, with our care, with our treatment plan, and really work through their unique needs and all their preferences, making sure that they get the best care they possibly can. I think EBP can give us the tools we need to provide adequate care, but our professional expertise and empathy also, it's just ultimately the only way for us to allow ourselves to make meaningful impact. EBP has transformed the field of mental health care by emphasizing accountability, effectiveness, and public health. I think it's really important to recognize its limitations just because we think about the diversity of client needs and the ethical considerations we face. It's important to always put the client first to make sure we're giving them the most ethically effective and helpful care we can. EBP provides a strong foundation for therapeutic practice, and the ultimate goal is to serve our clients as a whole people, considering their stories, their cultures, and their individual goals. Thank you everyone for joining me in exploring this topic. I hope this discussion shed some light on EBP, evidence-based practice, and if you have any questions or comments, leave them below. Thank you.